Hey, everybody. Welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Crystal Hohn. And today we have our friend, Dr. Julia Britz. She's a licensed naturopathic doctor. And she works with people in a really special way. She helps people who are struggling with mental health issues. She struggled with OCD herself and intensive anxiety. She helps people with eating disorders. She helps people getting off their psychiatric medication. And she really explains in this episode the proper way to do that and so much more. So I can't wait for you guys to hear this episode.
Well, thank you, Julia. We're so excited to have you come on. I have been listening to a lot of podcasts that you've been on, so I'm so intrigued by your story. So why don't you share that with our listeners about just your process with OCD and everything like that?
Well, thank you. And I'm really excited to be here too. And I think I'm glad you specified because, do you ever look back and you think like, oh God, which chapter of my life, which version of myself? Oh,
that's so true.
It's a lot. But I think like looking back in the mental health sphere, because that's what I do now, I never felt like a normal little kid. And I think because on one argument you think, oh, well, you're a child, you don't have a basis of comparison, but I knew something was wrong pretty young because the first day I was dropped off at school for, I think it was first grade, and I was horrified. The level of panic was completely disproportionate. And I looked around these other kids and they just seemed excited and they were like, oh, and they're running around playing tag and catching up. And I was like, I don't understand why they're not panicked. And I thought, oh, they're just hiding it better than me. That's the problem. And so I learned pretty quickly that it was just the way I was containing my emotions. I didn't know how to do that properly. Yeah. And so that turned into eventually OCD. And that's kind of where my belief system is now on mental health stuff. It's like it all comes from the same tree of anxiety, whether it branches off into depression or OCD or ADHD or whatever it is. Like it's all just kind of expressing itself symptomatically one way or the other. So I developed issues with obsessive eating when I was a teenager. And then I'd say around age 20, which is pretty common. That's when the OCD classically pretty much set in. And I was doing pretty overt compulsive behavior. So I would just park in a space, back out, repark in a space, back out many times. Okay. And then circle around the freeway because I thought maybe I'd run someone over and I better double check, So I did that and I thought, I just don't remember it. I just did it and I just forgot immediately and it must be there. And then walking backwards up the stairs to school. And I went to Cal State San Marcos. So we used to call it Cal State Stairmaster because we had so many stairs. So I just walked backwards up the stairs and I would just see people and pretend that I was like, oh, I'm just going to pause here for a second, pick something up maybe. And then when they were gone, I'd start walking backwards again. And I didn't really mind how embarrassing this was. I was way more tortured by the actual thinking part of it. And so I actually started working with a therapist who specialized in ACT or acceptance and commitment therapy. And he said, we can work on all this stuff. And I said, no, I don't care about the behavior. Just get my brain okay. That's what I want. I don't care how silly this looks. And he's like, no, it's all going to go away. It's all going to be fine once you accept it. It's going to be great. And it was very, very helpful. I'd say that probably got my symptoms down maybe 25%. I learned a lot of valuable tools. And it wasn't until I worked with a naturopathic doctor where she said, no, like this is physiological. Like you've got all kinds of things going on. Let's work on getting your body in balance and then maybe you'll get better. And so it happened quickly. And that sort of, for me, that's when I learned, oh my God, maybe OCD is not a disorder. Maybe it's a symptom. That's what sparked my interest in like, I think I need to go to med school. So here we are now.
And there's the journey, right?
Yeah. So sorry, go ahead.
No, I was just going to say, and I've heard you talk a lot about anxiety and I've heard you talk about like good anxiety versus bad anxiety. So how would you kind of differentiate between the two?
Well, I think if you're struggling with anxiety, it's all bad because it's completely dysregulated. Everything's a 10 out of 10 and there is no such thing. But if you can kind of at some point pull it back a little bit to where you've learned a few coping mechanisms, then it becomes a little more obvious about what's good and bad. And there's going to be this time that most people experience when their anxiety, depression, OCD gets better where they go, I'm afraid it's going to come back. Yeah. What level's okay? And that's the best time to ask. And so really at that point, when you're looking at what's good and bad anxiety, the bad kind is when it's, well, we'll start with the good. That's easier. But the good kind of anxiety is the kind that keeps you safe. It protects you. So it's where you're driving in a car, you're about to hit the brakes, and then you just go like this, and the cortisol's pumping through your body, and it keeps you alert, and it slows down time, so you have a chance to react and stay alive. And that part's really good. The bad part is when you feel that way all the time, and there's nothing going around, and you feel like threatened and you don't feel safe, and that doesn't actually match up with what's happening in your daily life.
Yeah, that's such a good way to describe it. I suffered with anxiety a lot too. So yeah, and it's that feeling of like everything is so, your nervous system is on such high alert, so everything feels dangerous sometimes.
Yeah, dangerous, threatening, unsafe, out of control. And I think that's where a lot of people will struggle. And they call OCD the disease of doubt. And what happens when you're full of doubt as you seek to control. And that's why I think we see so much, and I'm sure you see it too, with anxiety leading to perfectionistic behavior and leading to control issues and codependency, because it's all just the dance around the same topic of how do I control my feelings?
Yeah.
What
are some, since we're talking about anxiety, and people listening, they're like, okay, is this good anxiety? Is this bad anxiety? What can that lead to? Like, cause you've talked about even eating disorders, poor sleep, nightmares, things like that. Do you see that a lot?
I do see it a lot. And I think, it's hard, but because at some point, I think there's this relationship we have with our symptoms that this is the bad part of me. It's the evil part of my brain hurting me. I've got a bully up here taking me down. And in reality, it's just probably a very unawesome way that your brain is trying to protect you. It's like, hey, be alert because we don't know what's out there. And that feels really intense. And over time, that can get a little bit skewed and a little Frankensteinish. And so sometimes I think one of the easiest things for people to do when they start to get, when they feel like this is not going to work when you're just completely dysregulated. But if it's like a minor issue, say, okay, thank you, brain, for trying to protect me. I appreciate it, but I got this, and give yourself a little pep talk to help understand, because the more we realize we're in those moments, the more we can step back and start to get an impression of like, okay, I'm actually bigger than my anxiety. My anxiety is not bigger than me. And that's usually what it feels like for people in the beginning.
Yeah, it does. It feels overwhelming and like you can't control it. Or one thing when I first was dealing with like panic attacks is that the one thing that I was reading about it, and it was kind of like, someone said, the person who wrote the article said, when you start to feel anxiety or you feel like you're going into a panic attack, one of the biggest drivers of that is the fear of the panic attack, right? So the more you fear it, the worse it kind of gets. And it was like, you tell your body, like, go ahead, bring it on, give it to me. And I started to do that. And it did help. It was like, instead of me going, no, I was like, come on, let's do this. What's the worst that's going to happen? Am I going to faint in the middle of class? Okay, then I faint in the middle of class and I'll be fine and I'll get up and it will be over, and that really did help. Like, what do you think are some useful tools?
Well, I'm kind of loving that one. That is such a good one. And I think that's a huge aspect of what it is creating a new type of relationship where you can start to see your symptoms as not part of your body that's against you, because we can't selectively hate. And I think Zach Bush was the first person to kind of say that. Like, he said, if you get a viral infection and you hate that virus, like, you really can. It becomes part of your microbiome. So you end up just sort of hating yourself on some level. And I think that's true with anxiety, because we can't just hate half ourselves. We can't split off. So it's sort of at some point, whether that's through therapy or whatever's going on, creating a new relationship with your symptoms. It doesn't mean you have to like them. It doesn't mean you can't be scared of them. But it does mean seeing them a little bit more from like a neutral, wise mind kind of place, meaning, okay, maybe like a curious place. Maybe this is here to protect me. Maybe it's here because it's an old coping mechanism. Maybe it's here because I've got some toxic people in my life and I should probably pay attention to that. So instead of the alternative, which is like, oh, I can't believe this happened again. This is what I always do. I'm never going to get better, like that kind of stuff.
Yeah.
So, and it can take a while to learn how to positively talk to yourself. And when I say that, I mean, how do you say things to yourself in a way that's not completely critical? And the first step to me of this is like, just stop criticizing. Just stop.
Yes. Yes.
Yeah. And maybe learn to like try understanding it, right?
Mm-hmm.
Maybe get curious about it rather than just hating it and pushing it away.
100%. Like if we had a little plant and it wasn't doing well, we wouldn't be like, you're so stupid. Like we would say, okay, like
grow,
just grow. We were like, wait a second. Like we'd be curious. Like, do you need water? Are you in the right place to get sun? I'm so sorry, you're not doing well. It would be such a different dynamic.
Yeah.
So if we can like treat ourselves like a little plant, that would be helpful.
I love that. One thing that really helps me too is just asking myself, okay, am I safe? What is the best thing that can happen from this? What's the worst thing that can happen from this? So that's really helped me because it's like fear of the unknown with things, I think too, that a lot of people have anxiety about, right? Fear of what's going to happen or what, am I going to fall flat on my face or, so walking yourself and asking yourself those questions, that's really helped me.
And that's such a good one too. It reminds me of a book I had as a kid. It was called What If?
Yeah.
And the book was like this little girl where she was like, but what if like I'm late for school? And what if I get in trouble? And the whole book's saying what if scenarios. And then in the end, the mom says, well, what if everything works out fine? And it's a very cute story because it sort of exemplifies this topic of, if we put this much time into anticipating the negative, we can at the very least meet ourselves halfway and go, okay, well, what actually might turn out right? Because life is kind of a bell curve where like, think of your worst case scenario, think of your best case scenario. Neither one's that likely. What's likely is something in the middle.
Right in the middle.
Yeah,
And that's
so
really
true.
how it is. And then you go through it and you're like, wow, that was okay. I'm okay. Right. So yeah, I know. It's hard though, especially
really hard.
People. It is hard. It still is hard.
Yeah. And I don't want to say any of this stuff to imply that it's easy. I say it because it's simple. It's very simple, but it's incredibly difficult. And when you're at that moment where you are completely bouncing off with anxiety and you can't self-calm, like none of this stuff is going to work. That's not what it's for,
Right.
So I would have to, like when I used to get it sitting in class a lot. And mine was actually being driven by histamine intolerance, which I didn't even know I had at the time, and by low blood sugar, because I wasn't that hungry, but I needed to be eating more often than I was and more like protein and stuff. And I would get this dip in blood sugar and I didn't feel hungry. So I didn't realize that's like, I didn't make the connection. And all of a sudden I would be in shambles. And I had to get up and get out of the, my biggest fear was that people would see something weird happen.
Yeah.
And I had to get up and get out of there. And for some time that would work. But then I started realizing if I ate, then it would completely go away. And I was like, wow, there's this connection between blood sugar. And then once I learned about histamine, because all my favorite foods were histamine, I used to drink kombuchas at school. And I'm like, why do I feel so weird? And as I'm like drinking that,
yeah,
you're like, it's my enemy in a bottle,
but I love it.
I know. Do you respond that way to kefir?
I never really dug into kefir much. I was never a kefir. I did used to eat a lot of yogurt. And I didn't, but that was when I was more like a kid. So I don't know, but I have definitely alcohol for sure made me feel that way. Maybe not at the moment, but later, and certain like fermented foods and certain things. So for sure.
Yeah, for sure. Can you elaborate a little bit more on the therapies that really helped you? Again, you mentioned a little bit in the beginning of us talking, but just for listeners, who are going through this anxiety and OCD.
Yeah. So the standard of therapeutic care for psychotherapy is either ACT or CBT, and ACT is acceptance and commitment therapy. CBT is cognitive behavioral. Usually people say, I'll do whichever one doesn't require exposure therapy. Well, they both do. So remember that. And I've done both. I started off, I was actually in my college campus, and that's where a lot of my symptoms had manifested. So I went to see the school counselor, and she was very sweet. She's like, I've never treated this in my entire life, but I got a supervisor. We could try some CBT, and she was super nice. So I was like, yeah, let's do it. But we didn't get too far, and I think for me, I had my OCD was so severe, they said, let's do some Zoloft with this. And I was like, no, I was way too afraid of taking a controlled substance unless I could get it myself illegally from Mexico, which I did. So it's like, again, the control issues.
Yeah.
But I did about 8 weeks of CBT. It got me to a place where I could at least accept I had OCD. That was the first part. I was like, okay, I think I really have this. I don't know if it's going to go away. Like all that stuff that really comes with the admitting to yourself that there's something going on. And so, and I knew that admitting felt like the biggest step, but it wasn't. It was just the first step. So I was like, I cannot sit back with this. I'm going to have to go full force into therapy. So I decided to try something different. And I met this therapist he said, look, we can do CBT or ACT. I'm head of the board for blah, 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 blah. Either one has great success. It's what resonates most with you. CBT is a little bit more, I had the book in the sense it's pretty classic cognitive therapy. It's like based on Aaron Beck's work, so we kind of work on like, what are your distorted thoughts? How do we wind those back? And then we work on, exposure response therapy so you don't compulse as much.
Yeah.
And it sounded a little mechanical to me. So I was like, I don't know if I like that. And then ACT, he's like, it's sort of a little bit Eastern in philosophy. It's based on Stephen Hayes' work, and it's about accepting the thoughts like leaves in a stream. And I was like, that sounds great, because I thought to me, it was such an invasion that I could not believe it could go away.
Right.
So I was like, I can at least accept that it's here. I can get on board with that. But the idea that we can eradicate it, that's just not realistic. So, but I actually loved ACT. I did it for about a year. And I know there's other types of therapies you can do for it, and it is important. I've had a lot of patients reach out to me or like in the beginning say, hey, I've had some therapy. Great. What'd you do? Oh, I worked with the pastor at my church. Oh no. Wait, hold on, because there's the issue I have with that, and this is not to criticize any specific church or doctrine at all, but my issue is that so many people have done something similar and have been shamed or been told on some level that you've caused this, you did something wrong, this is your punishment, you've sinned. And it happens way too much. And so it's really important, to get the actual proper therapy for it.
I agree strongly with that.
Yeah, for sure.
So where are you now with the OCD?
So right now I don't have any symptoms consistent with an OCD diagnosis. So when that first happened, I thought, wait, do I have OCD? It's just in remission. But no, I definitely don't think I have OCD at all. And it's been quite a few years, and I was pretty scared it was going to come back. And I remember one of my last therapists had said just what you were saying, Becky, about, hey, you know what? It probably will. So what you're going to do with it, you know what to do. And it took the power away of like, oh my God, it can't. It was just too intense. And I had a couple bad days over the years in the first 5 years that it was no longer an issue for me, because you learn to cope a certain way. And then when stress happens, you're still trying to cope as if you have OCD, sort of.
Right.
So it's more of that. But I really don't have any symptoms now. And I have what I would call healthy anxiety right now. And then, which is much, much better. And I'm more okay with that.
That's amazing. That's so great. Yes. So we heard you talk about how meditation made you feel unsafe, because everyone's go-to kind of right now, especially is meditation. So can you tell us how that went?
Oh yeah. So it was during I was in a yoga class, I was laying on my back, eyes closed, and I'd always kind of struggled with the concept of closing my eyes around other people. Never felt really
Okay.
safe doing that. But I was like, okay, I'm gonna try. And I was so tense. And it was during this meditative part of it where he's like, all right, breathe in, breathe out. And I got so viscerally angry of like, you breathe in and out, kind of that reactive, like, don't tell me what to do sort of thing.
Yeah.
And I just remember like I was tense physically, had this rage out of nowhere, and I felt completely unable to do what he'd asked me to do, even though I was trying to. So it was like this weird, like, I'm gonna relax, but I can't relax kind of thing. And when I stood up, I was completely dissociated. And it was the first time that it happened to me where I was walking around and I thought, do you see me? Are you looking through me? This is so weird. And I felt really tired and everything looked like a movie set. And I felt like I was walking kind of in a dreamscape.
Yes.
And I thought, okay, I need to test this out. What's going on? So I started walking. I had a grocery store near my house. I was like, I'm just going to go in real quick. And I was like, I'm invisible. No one can see me. And it wasn't like I just felt invisible, like no one pays attention. And not like that. I truly believed, like on a delusional level, that no one could see me. So I got home and I was like, I'm just gonna wait it out, I guess. So I did. And then I felt exhausted and I was completely fine, but exhausted. And then I went to see my therapist the next day. I told him what happened. He's like, no more meditation for you. And so I kind of, he had explained to me at the time, he's like, some people, it's just safer to have a chaotic brain because you're used to that. And if you try to relax, it actually has the opposite effect because then you feel too vulnerable, too exposed, and you don't have that level of protection you've needed for a long time. And then your body will just check out. And so that happens to, I think, a lot of people.
Do you find that a lot with your patients too, with working with patients? Meditation isn't necessarily the best thing for your patients who struggle with OCD. So you see it yourself?
I do. And it's mostly with people that have a history of trauma is the most common group. And especially if we're coming in, most of my people are coming off psych meds. And what'll happen is that they start to feel their feelings because most antidepressants are slightly dissociative.
Yeah.
So they start to go, oh, I'm feeling all this stuff. This is interesting. They go, you know what? I have got trauma. I didn't know that. I should go to therapy for that. And then they go to trauma therapy. But the problem is it's like this new little kid that realizes they have legs and they just go, I'm going to run. And then they don't really know how to run and stop. And it's kind of all over the place. So when that can happen, sometimes therapy, depending on the type, might be gentle enough, but for a lot of people, it can lead to a lot more of these like dissociative episodes, depersonalization kind of stuff, or feeling way too many feelings and then wanting to go back on the meds. And it can be a little bit quote unquote out of control and way too emotionally raw. And so I do like to encourage people like, hey, let's try to work on one issue at a time because we have so many moving parts and it's hard enough to kind of manage one of those. So adding in new things, and it's tough because you get excited. You're coming off the med. You're like, oh, this is actually not as bad as I thought. Maybe I can handle this. I should handle this. I'm taking charge of my life because you are the phoenix rising. You're letting go of the big pharma bullshit. You're getting off your med. You're feeling really good, or at least decently good. And you're like, let's handle it. And then boom, wall. So
yeah. You're talking about meds, right? And this is a big topic. And me and Beck see, patients in the practice who are like, really want to get off my meds. And how do patients do that safely? And how do you work with patients when you're doing that?
Yeah, so I ran a facility in Sedona for a couple of years called Alternative to Med Center. And it was a dual diagnosis facility. It was voluntary. So we had people coming in that had bipolar 1 and 2, schizophrenia, OCD, alcohol, you name it, and then coming off their medications or at least trying to find a better dosage.
Yeah.
So I was in charge of the naturopathic department. So I did more of like, oh, hey, this is what diet we can do. And these are the supplements we can use to support you through this experience. And I had a really great team at the time. And so, we did lots of breath work and IV nutrients and all kinds of great stuff. So I thought, okay, I'm going to private practice. Don't have a lot of these tools. But the good news was a lot of people are like, I can't go to a center. I can't be around that many energies, that many people. I can barely leave my house and go grocery shopping. This is not going to happen.
Yeah.
So those people, they needed someone that could meet them in their home, at least on a computer, because they had maybe enough support. They're like, I at least have my family or a friend or, a spouse or something. And some of them don't, but most do. And at least from that perspective, they didn't feel like, well, it's either I suffer or I have to find a way to get to this really intense facility. And so there had to be a middle ground. So when I'm working with someone, I just have to make sure that they're a good fit for me to help them. Meaning if it's too acute and I really think inpatient's better, like I'm going to say that. Because as you guys know, like anytime we get out of the insurance networking system, this stuff gets really expensive. Supplements are expensive. And I want to make sure that if we're going to work together, then it's going to be beneficial for both of us. I can help you, that you're going to get help, that kind of thing.
Yeah, we agree. We've turned down a lot of people are not, we'll just lead them into another direction sometimes because they're not ready, for what we do or, whatever the reason. So, we work a lot with histamine. We've already talked a little bit about histamine, and we know histamine plays a big role in the brain. But what is the relationship with histamine and the psych meds?
It's a very interesting one because we don't really know how the GABA system is so complex. It's arguably the most complex neurotransmitter system in the body because of all the shuttle pathways. So we don't really know exactly how it works.
Yeah.
We do know that GABA sort of acts as a mast cell stabilizer. In a way. So for a lot of people, when their benzos are gone, they get all these histamine kind of responses that'll pop up later. And of course, a lot of people are on, different medications like Vistaril or an SSRI, and serotonin has this sort of inverse relationship with histamine. And so I see it a lot where people will, they get to this point where like they don't trust doctors anymore because their doctor put them on a med. And it's like, I don't know how to take you off. Sorry. By the way, you're crazy. Like that's the vibe.
Yeah.
And so they go, okay.
Yeah.
I can't trust doctors. I will just do this myself. And then, they have these online forums, and the benefit to those is that there's a sense of fellowship of people going through what you're going through. The downside is that there's, a lot of really, really bad advice being given. So we, it's kind of like a little that way. And so there's a lot of people that are struggling, trying to figure out what's wrong with me. Like, is this withdrawal? Is it mast cell activation syndrome? Or is it akathisia? Like, what's going on? Because they're feeling symptoms from everything.
Yeah.
And so it can be very challenging to know, if I have all these, how do I even ask for help? Because if you go to like a doctor that's not really versed in this kind of stuff, and maybe it's a confusing dynamic to begin with, or who knows what's going on. But if you say those words like, I have akathisia, then you're going to be put on the wrong medication for withdrawal. You're going to be put on a dopaminergic drug, worst thing you could do. And then if you say like, I've got mast cell, like they're going to run probably the wrong tests, not really figure out if that's what's going on right now, and say, well, just take Benadryl.
Yeah.
Is that okay? And then don't take your supplements. I don't know what those are. We get a lot of that.
Take an antihistamine every day for the rest of your life.
Right.
That's
what we hear, patients who come to the practice. Well, what'd they do? Well, they got me on this medication and they said, I'll need it forever. And well, what else did they do? And that's it. Nothing.
That was it. What do you mean?
I know.
Yeah. I think that's pretty common for, I'm sure you guys and me, is that most people, I think, that are put on antihistamine drugs or on or different types of psych meds, there is no termination plan put in place. Right. There's no like, hey, let's do this with the intention of blank.
Right.
Or like, let's do this so we can calm you down so that you are receptive enough to the therapy we want to do to resolve the underlying issue. Like that should be the conversation, but it's really not. And so many people don't really know why they're put on the meds. I have a lot of patients who are like, I've been on this for 30 years. Why? I don't remember.
Yeah.
That's really common.
Yeah. Is it helping you? I don't know.
Yeah.
Yeah.
Julia, are you
like, I don't know. Like,
did
it just
you
occurred
take any?
to them.
Sorry, Beck, I didn't mean
to.
No,
it's okay.
Did you take any meds throughout your process? I know you mentioned Zoloft in the beginning, but are you on anything? Do you kind of walk us through that a little bit and your experience with that, if so?
Oh yeah. So I was extremely anxious, having awful OCD, and I used to always think my liver was failing. And that was my like body obsession. I was like, oh, I know that's what it is this time. So we were constantly at the ER. And one time this ER nurse, she's like, your heart rate's really high. And I said, oh yeah, I know I have OCD. She goes, oh. And then like this glowing bottle, like this, like came forward of like Ativan. And I'd never heard of that. And she's like, but I didn't want to take it. I was pretty scared. I was managing my symptoms with alcohol, and that seemed better, alcohol and food. So we get home and I was like, I'm not taking that stuff. I don't want to take it. But then I had such a bad panic attack shortly after that I was like, I'll just take it. And it worked within seconds. I felt so good. And in reality, if it's the first minute, it's probably placebo, but still, I was like, oh, this is amazing. I feel like what I think normal feels like. I'm having a break from all these awful symptoms. And I went through that bottle of 15 tablets very quickly. And so I tried to get more. I was able to get a few more from different doctors in town. Started doctor shopping. And then at the time I was living in San Diego. So I was like, I think I can get this in Mexico. And at the time you really could get whatever you wanted in Mexico. You can't now, but back then it wasn't so bad. So I would go down to Mexico, and different pharmacies, I started to notice like some of them wouldn't, some would. And then I just kept track of where I could get them. And then, like say I lost I'd be like, oh, I lost it. I need another one, that kind of thing. Stealing my friends, did that. So, and then of course, like my other friends were also taking different meds, and we would trade, like, which was this one do? I just started getting really into it. So I was on Ativan for a long time. And so in Ativan, you really shouldn't take longer than, maybe 3-4 weeks, because it is an amnesic. They've linked the studies are not great, but there is a good suspicion that it is linked to increased risk of dementia. But regardless, I was on it for 10 years. The highest dose I ever was on was 10 milligrams a day. And I had to take about 1 milligram every hour just to stay stable. And so I came off it 3 times. The first time I just did a slow dry taper, meaning slow little cuts off the medication. And that was all right. And the reason I came off it was because I'd woke up one morning and I was in acute withdrawal, and I didn't know that's what it was. I thought I was like, I'm crazy, because I had this like flu-like picture, this awful pain going up my spine, and I was just thrashing on the bed, and I was sweaty, and I didn't know what had happened. I realized I just forgot to take my medication the night before. So I was like, wow, this is a pretty strong drug. I didn't know that. So I came off of that the first time. Second time was much harder. And the third time, which I was at a much higher dose, I got stuck around the 2.5 milligram mark. That's where I just could not cut down anymore. And that's when I started working with naturopathic doctors and body workers and biohackers. And everyone was great. They're like, we don't know how to do this, but let's try this. And I was very experimental. I was like, yeah, that sounds good. I'll try that herb and that vitamin injection. Let's do all this stuff. And I kind of kept track of what was helping and like what didn't. And it was really kind of a Frankenstein situation, but it seemed to be really effective. And so I actually never planned to go into like drug discontinuation, but I had such a personal investment in that. And I saw how many doctors just didn't know how to do this. And that's because they're not trained. Like, it's not part of the med school curriculum, besides the whole, like, oh, you just 2 weeks is sufficient and you just do it by 50%. Everyone remember that. Good, done.
Yeah,
it's true.
It's so much more complex than that, right?
It's way more complex. You've got some people that can just swim off like a high dose of something, no problem. Other people are doing these 1% cuts and they can't function. So we definitely can't treat everyone the same, because we've seen different complications like, Lyme and co-infections and TBI and all kinds of things can complicate a taper because the nervous system's already so fragile.
100%.
So we have that. So I can't just, pull or whatever. It's very different. So I don't have like a protocol per se. I have things that I've seen work pretty effectively for most people in certain circumstances, but it's I wish I had a protocol. It'd make my job so much easier. I could just sell it and be like, just buy my protocol, boom. But like,
yeah,
I don't have that right now.
Complex.
but at least you have the tools to kind
do.
of figure each person out. And that's
Yes.
really important.
Yeah.
Yeah.
How long do you typically see, like in practice, Julia, like patients coming off of meds? Like, does it take like 6 months, a year, just an average of what you see tapering?
Yeah, about 6 to 12 months is average.
Okay.
And it probably depends what they're on, how long they've been
what
on
they're
it.
going through.
Yeah.
It really does. I had a patient, she was 14, really bad suicidal ideation, moodiness. They were tossing in like a borderline diagnosis, which I think is the most garbage diagnosis on the planet. And so I'm like, okay, no, that's not what happened. Anyways, and she had awful GI issues and, you know, couldn't sleep at night, that kind of thing. So I look at her med list. She's on like 4 psych meds, and they're medications I think people kind of forget or maybe don't know. The dosage is intended for a 150-pound man. And this little girl is like 100 pounds, you know?
Wow.
And so she's on max doses of all 4 of these medications. And so at this point, they want to just come off the meds. They're like, they're not helping. We tried so many psych meds. We just want off. We don't even know what's happening underneath anymore. I was like, great. So we start pulling the medications, and the weirdest thing happened. She started sleeping more. So we were coming off of antidepressants and Buspar, mirtazapine, that kind of thing. And that's really irregular. Someone should sleep less when you come off of that. You usually get insomnia. She's sleeping more. And so I'm like, I don't know what's happening. And she started getting, mom's calling me. She's like, she's sleeping 18 hours a night, 20 hours a day. I'm like, what? And so get on the phone with her. She's falling asleep mid-sentence.
Wow.
I'm like, what is happening? So we run a narcolepsy test. So she has narcolepsy. That's what it was.
Mm-hmm.
Wow.
So I'm like, okay, so she has narcolepsy and she's tapering meds. We run an MRI just to see what else is going on. And the mom had asked me, like, what caused what? Like, is it the meds? And then we ended up running a food sensitivity panel. And I was like, honestly, she's probably just allergic to these foods, caused a lot of psych symptoms, medications probably worsen what's going on. And then the narcolepsy got triggered because she's the age for it. And that can happen under stress as well. So we just have to pull it all back, which is what we did. But that's a really good example of how tapers can get complicated and weird.
Yeah.
And sometimes you really can do this yourself. You can. But for a lot of people, it's really,
difficult.
Having a team can be helpful on your side.
I think for most people, it would probably be best to have someone like you.
Yes. And someone to work with your body to help that process along, because there's so many things you can be doing otherwise, right, to help that. So what are some of your favorite like herbals and micronutrients that you like to use for mental health? And we can even get into some of the functional testing too.
I know, right? So I use so funny. I actually wrote a blog on this because it was such a big question people have, but I like tryptophan a lot. I like magnesium a lot. And I like, a lot of herbs like lemon balm and avena are really, really nice. These are all different things that have been noted on different forums. Like, don't take them.
Mm-hmm.
But I'm like, no, please take them. They're helpful.
You're very
Not for everybody,
helpful.
but like for a lot of people, it can be. And I get it. It can be nuanced, but I'll say this about magnesium is that most people are deficient in it. Most people do well on it. There's very few people that truly have a problem with it. I had one patient who, she was really straightforward. She's like, look, I really can't tolerate it. I tried this kind. I was like, ooh, but have you tried this kind? She's like, no, I haven't. So we tried it. She's like, oh my God, I love it. It works so great. So a lot of times it's not, and we're correlative creatures. Like we want to try to figure out what's connecting what. So we're like, oh, I had a really bad OCD day. What did I do? Okay, well, I took this new stuff. It's probably that. And like in reality, it's like, no, you're probably having a reaction to the nightmare you had because you ate sugar 3 days ago, maybe. Or maybe it's because this is the anniversary of something bad that happened 3 years ago. Like there's 1,001 things that could be causing this mood, but we like to just sort of pick one thing that we think it is. And it makes it really, really hard to know. And that's, again, part of that control thing of like, right. I'm anxious. What was it? How do I manipulate the situation? Manipulate in a kind way, of course.
Yes, exactly. Right. It's so complex when talking with patients because it's hard.
It is hard. Like, and I'm really not like I don't know. I don't do the white coat thing. I hate doctor speak. I just can't do it.
We don't either.
Yeah, I know you guys don't do it either. Like,
I think it's funny when people are like sitting in their living room with their stethoscope and doing like
I'm just like you.
Home. Yeah. What exam are you doing over there? Okay. So if you had to give the listeners like the top 3 things they can do to support their mental health, what would they be?
Believe that you are capable of healing. Research shows that if you believe you can, you have better chances of actually doing it. And it's just better to believe that you can and be wrong than believe you can't and be wrong. So
it's very true.
First step. And the next thing I would say is the old homages are correct. Are you sleeping? Are you eating enough produce? I know it's really boring. I know that's really boring medical advice, but it's true.
It's so true.
So, and I forget his name. It was, I forget. But anyways, this other doctor, he had said a way to kind of tell how your health is if you're having a bowel movement every day, if you're sleeping quality, good hours at night, and if you have adequate energy and you have appetite. So I kind of look at it that way. And then the last thing I would say is, I'm a little annoyed at this because I'm a very like self-sufficient person, and it's very easy for me to be like, I don't need anybody. But the truth is, research is pretty supportive of the fact that we do better if we have at least one person in our lives we can confide in.
I love that.
Like there's one friend of some kind that we can talk to, feel totally unjudged by. And that would be, I know this is 4 things, but the 4th thing would be stop criticizing yourself and others. Just stop doing it. Like, I can't do this. I'm not good enough. Just stop doing it.
Yeah. That self-doubt or like talking down to yourself. Yeah, it's so true. I love those. Those are great.
Me too. They are. And there's always someone out there that is willing to help, right? There's so much help out there. You just got to be open to it, right?
Yeah. And that'll be whenever, you're ready for it. Like, I think there's nothing anyone could have told me to go to therapy. Like I was just, I'm too scared. And you have to figure that out for yourself when you want to go and when you want to try something, and be fully okay with the fact that you might try something and it won't work. And it doesn't mean there's something wrong with you. And that's really unfortunate for mental health, because like people go to rehab and then they relapse. And everyone's like, oh, you failed rehab, which is crazy. Because like if someone did an antibiotic for an infection and it didn't work, they wouldn't be like, you failed the antibiotic.
Right.
Like, how could you? They'd be like, oh, maybe it's the wrong treatment. So it's so easy in mental health just to put all this blame on the lack of willpower. But if this was a willpower problem, then you could teach that to people and they would be better, but it's not.
Yeah.
That's a really good point.
Thank you.
This is so awesome, Julia. You've been so great. Where can people find you?
Oh, thank you. This is fun. So the easiest way would be my website, which is drjuliabritz.com, like drjuliabritz.com, or Instagram, which is also Dr. Julia Britz.
And you do work with patients one-on-one? Do you virtually too?
Yeah. So I have a practice here in Las Vegas, but I work, I'd say mostly telemed, to be honest, with people from all over. Yeah. And so I like to have discovery calls first, just to make sure, hey, are we a good fit? And also just to let you know if there are any parameters, like, hey, like we can, but I also need you to have this person on your team too, or whatever.
Yep.
Great.
Well, awesome. Thank you so much for coming on, and thank you everybody for listening.
Yeah. Thank you, Crystal. Thanks, Becky.
Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on drbeckycampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Crystal Hohn. Have an amazing day.